that most people who worry about their mental decline do not develop dementia, the most common form of Alzheimer's. What they are experiencing is truly natural and normal aging. Dr. Ronald Peterson is a member of the Alzheimer's Association National Board. He says people should be tested if they fear they might have the disease. He says doctors might ask patients about other issues like any medicines they are taking or whether they suffer from anxiety, depression, or stress. He says all those things can cause changes in memory. For VOA Learning English, I'm Alex Villarreal.
This is the VOA Special English Health Report. Loud snoring can be a problem, and not just for other people trying to sleep with the noise. It can also be a sign of sleep apnea. People with this condition repeatedly stop breathing while they sleep and may not even know it. Dr. David Gross at the National Rehabilitation Hospital of Washington says, sleep apnea means that the airway, the upper airway, cuts off at night. The muscles get all relaxed and cut off, and this can happen over and over again, 60 to 100 times an hour. Most people who snore do not have sleep apnea, but doctors say most people with sleep apnea do snore. Sleep apnea not only reduces sleep quality and makes people feel tired during the day. More and more studies show that it can also lead to strokes and heart attacks. Dr. Michael Twirry at the National Institutes of Health explains why. Whenever we run out of enough air to breathe, it sends alerting signals to our minds. It raises the level of stress hormones. It tells our heart to work harder. When a person stops breathing, oxygen levels in the blood decrease. This happens again and again with sleep apnea. Dr. Twirry compares the effect of sleep apnea to racing a car engine for long periods of time. Our heart becomes overworked, and we become more vulnerable to heart attack and also strokes. Dr. Twirry led a study of about 9,000 people who had sleep apnea but no history of heart disease. The 9-year study showed that the more severe the sleep apnea, the greater the chance of a stroke. Dr. Twirry says it found that men can experience up to a 3-fold increased risk of stroke. Sleep apnea seems to be more common in men than in women, and it becomes more common as people get older. The most common form is called obstructive sleep apnea. People who have it are often overweight or have it in their family, but it can affect anyone. In children, for example, enlarged tonsils in the throat can interfere with breathing as they sleep. The next step in research will involve sleep apnea patients who have already had a stroke or heart attack. Researchers will study whether patients can reduce the risk of a second one with a machine called a CPAP. CPAP is continuous positive airway pressure. It provides a flow of air into the throat and lungs while the person sleeps. For VOA Special English, I'm Carolyn Presutti. To read and listen to more stories And for English teaching activities, go to voaspecialenglish.com. This is the VOA Special English Health Report. Wisdom teeth are normally the last teeth to appear. This usually happens when people are in their late teen years or early 20s. In other words, when they are older and wiser. Wisdom teeth are molars, or chewing teeth, at the back of the mouth. The third set of molars, if you have them, are your wisdom teeth. They can grow into place normally and never cause a problem, but often there is not enough room for them in the mouth. They might crowd other teeth. Sometimes they even push sideways through the gums. An impacted wisdom tooth is one that fails to completely rise through the gums. The term is erupt. Wisdom teeth that only partially erupt can leave space for bacteria to enter around the tooth. Infection is a risk in these cases. Wisdom teeth that are not well aligned and become impacted are often removed. People should have the placement of their wisdom teeth examined between the ages of 16 and 20. X-rays can show wisdom teeth that are below the gums. The American Dental Association says removal is generally advised when wisdom teeth only partly break through the gums. Removal is also advised if there is a chance that poorly aligned wisdom teeth will damage other teeth. And removal is called for in cases where fluid collects around a wisdom tooth that is partly or fully below the gum. But why do we have wisdom teeth if we often need to get them removed? One theory has to do with our diets. Scientists say the diet of prehistoric humans probably required more chewing teeth. Life was probably a little rougher on the teeth back then too. So it was good to have extras. The removal of wisdom teeth is performed by oral surgeons. They say if removal is advised, the best time to do it is before the teeth cause any problems or pain. The American Association of Oral and Maxillofacial Surgeons says young adults are the best candidates for wisdom teeth removal. The group says older patients may be at greater risk for disease in the tissue surrounding the molars. Patients can have general anesthesia during the operation, or they might choose to have a local painkiller and remain awake. It may depend on the condition of the wisdom teeth and the number to be removed. After surgery, there can be swelling of the gums and face and some pain. Both can be treated with cold wraps and medication. For VOA Special English, I'm Carolyn Presutti.
This is the VOA Special English Health Report. Watching the Olympics probably made some people feel a little guilty about not exercising. The truth is, if physical inactivity were a sport, a lot of us could give a gold medal performance. To mark the London Olympics, The Lancet, a British medical journal, published a series of papers about the problem of inactivity. Public health experts say physical inactivity is the world's fourth leading cause of death. They estimate that inactivity plays a major part in 6 to 10% of deaths from non-communicable diseases. These include conditions like heart disease, diabetes, and colon and breast cancer. Aimin Lee at the Harvard School of Public Health worked with a team that studied inactivity. She says the findings are conservative and may even underestimate the problem. She says physical inactivity is harmful to health, as harmful as far as deaths are concerned as smoking. The researchers compared data on physical inactivity with disease rates in 122 countries. Aimin Lee says researchers considered many behaviors in their study that may be associated with increased or decreased risk of disease. She says, for example, we know that if you are active, you probably smoke less. Additionally, we factored out obesity, independent of the fact that active people also tend to weigh less. Harold Cole is with the University of Texas School of Public Health. He also worked on the special report. He says physical inactivity should be recognized as a global epidemic. We have to realize that high-income countries are the most inactive around the world, he says. But low to middle-income countries are not going to be far behind as things change. He says as economies develop, people basically engineer activity out of their daily lives. Harold Cole points to campaigns that continue to reduce smoking and alcohol use. He says the time has come to target physical inactivity as a major threat to public health. He also says it is becoming clearer that our environment plays a big part in whether we exercise or not. Aimin Lee agrees, and she urges people to do moderately intense exercise for 150 minutes a week. Anything you can do is great, she says. Even if you don't reach that 150 minutes a week, a little is better than none, and more is better than a little. She plans to return every 4 years, just like the Olympics, to give a progress report on how the world is doing. For VOA Special English, I'm Mario Ritter.
I'm Alex Villarreal with the VOA Special English Health Report. Delegates from around the world met in Uruguay in November to consider new ways to control tobacco. A World Health Organization treaty called the Framework Convention on Tobacco Control took effect 5 years ago. More than 170 governments have signed it. The treaty requires a number of efforts, like raising tobacco prices, restricting advertising, and banning